renal biopsy, because this could be just like simple, basically trauma to the kidney. So make sure you order renal biopsy after you have received all your investigations, and the investigations you detect that this person has a nephritic syndrome from the proteins and from the urinalysis, the blood in it, and from the kidney function test. So now I know that I have no other choice. This patient's not diabetic. This patient's not like in heart failure. He doesn't have any kind of hepatitis. He's possibly nephritic, in normal patient with swelling in the face. Get me a kidney biopsy, a renal biopsy. That's your end stage treatment. Of course, you can do some lipid profile and blood glucose studies. That's part of investigations, and hepatitis B serology to make sure that you can detect some sort of glomerulonephritis that can be caused by, for example, infectious conditions. Management of the kidney salt restrictions and avoiding the fats. In the end of the day, all the kidney diseases, remember, get prednisolone, and you all know that that's it. Treatment is either basically immunosuppressants or prednisone. That's not the case. All of you know that. But however, what about the salt restriction? Did you guys know that? To tell the patient? Did you tell the patients to avoid fats? Did you know that? And were you able to provide diuretics for the patient to decrease his volume overload? And how did you manage that? Was there urine output or no urine output? And sometimes you can just provide some ACE inhibitors therapy, which can be actually good for the for the patients who are hypertensive. And of course, the main treatment, stay of treatment, is prednisolone or immunosuppressants. That's all. Okay, so this was ankle swelling, and now we're done with the cardiovascular system, and I believe you guys have to practice these 4 cases again. Heart failure and chest pain case 2. Another one was for trauma, cardiac tamponade, that's 3. And there was, I believe, arrhythmias, the blocks, the arrhythmias, how to treat the arrhythmias. So these 4, you have to be very fluent on how to manage it, especially do your ACLS protocol to make sure that you know what to do in case you forgot it in the past. Some kidney problems, for example, nephrolithiasis, flank pain. They present with flank pain. Of course, there's patients that can be treated. This is a type of thing that the patient will possibly present in an emergency room scenario, and you'll just need a simple treatment of analgesics and pain control, and do the investigations. For example, do a CT, or once you do an ultrasound if it's a pregnant patient. Once you detect that what is the kidney stone formed for. Is it a calcium kidney stone? Is it uric acid stone? And after you found out that, you possibly want to get a urine analysis to make sure there's no kind of infections. And if there's any infections, you just provide antibiotics with that. If the patient has some vomiting, it's very easy for you to provide some vomiting, for example, ondansetron that can be provided, or promethazone that can be given to the patients for vomiting, right? Interventional treatments, urethric stones, cystoscopy, percutaneous nephrostomy. These are done in scenarios where there is a non-resolving, pyelonephritis, or something that's actually the non-resolving pyelonephritis, of course, is the reason that there's some sort of blockage out there. So that's why it's done usually at that scenarios. And urethric stent can be done in, like, for example, as an interventional method, but it's not an acute treatment for patients at this point of an emergency situation. In emergency situation, you just have to remember to treat the pain first. Eye fluids, vomiting. After you detect what's happening, what is the size of the kidney stone, then you can look into the interventional or surgical treatment of the patient. The most important thing is that you have to actually know that when to admit the patient to the ICU, or when to admit the patient to the wards or to the hospital, basically. If they have severe pain and vomiting that's uncontrollable, fever, which it points to the infection, which we have to treat them with IV antibiotics, right? and the renal function tests are worst. And basically, if they have one kidney with urethric obstruction or bilateral obstructing stones, so we admit them